having 50 to 100 deaths per day. So all those things are on the improving side. The CDC COVID tracker has us at over 900,000 shots having been given. I know that's an underestimate, but it's improving. And while we were down at the bottom of the heap, according to the CDC, in terms of the administration rate, as of Friday, because of some workarounds we've done to make sure the data is getting in there, we're at 38th, and I'm sure we'll continue to climb higher in the state rankings than that. You can find the allocations of vaccine on our website that's devoted to the vaccine, and that's what you see here depicted, www.kansasvaccine.gov. That'll tell you by county, week by week. It talks about the number of doses delivered to the state, which is a little over 1.1 million doses, and by age, gender, racial and ethnic background, and the like. Next slide, please. Can I have the next slide, please, Marisa? Marisa, can you hear me? Can I have the next slide, please?
Can you see it moving at all?
It is not moving according to me. Mr. Chairman, do you have the slide deck in front of you?
I do. We do.
Okay, let's just go ahead and go through the written handout then. And if you catch up, Marisa, that'd be great. Slide 3, I gave a brief summary, but one of the things that I think we're seeing around the state, especially in phase 1 with our healthcare workers, a terrific sense of relief in terms of getting the vaccine into healthcare workers, first responders, and the like. We first phase as well, of course, with the long-term care and assisted living people. Anybody that's wanted the vaccine in that category has all been vaccinated now, and that's important because the federal program that delivered the vaccine to long-term care and assisted living persons now are not sending to them anymore because they've received the first and most of them the second dose, and are now coming to the state, which will increase our allocation for the public at large. Next slide, please, is slide number 4. It says, how are vaccinations going in Kansas at the top? This is actually a little bit dated already. This is as of 12 March, so that's 3 days ago, I guess. This comes right off our website. You can go there. Again, 790,000 doses listed on our website. We'll update that today, but we're at 900,500 doses in the state of Kansas, as per the CDC data tracker. 1,000,167 doses. I'm real pleased that we've had no lapse in any of the vaccine being sent to the state of Kansas. In other words, there's been none slip through our fingers for any reason. And again, we don't stockpile it at the state. We push it right on out to the vaccinating sites, the counties, and the health departments and hospitals and FQHCs and the like. Next slide, please, is slide number 5. The federal supply to continue to be the largest barrier. We could flex up and probably, without even working overly hard at it, 5 times the amount. If it would come to us, we would be able to push it out. We have enough vaccinating sites for probably 10 times the amount of vaccine that we're currently getting. You'll recall maybe that back in December and January, early on, there was we were getting about 45,000 doses a week, and now we're more at 140, 150,000. And you see on slide number 5 there, some of that, it's in Pfizer Prime as the first dose, and then is followed on by a boost. Moderna, ditto that, Prime and a boost. Johnson & Johnson is a 1-dose vaccine series. We got some of it at the end of, right at the 1st of March, essentially, and about 23,000 doses. There'll be a pause, and then we'll get some more of that later on this month from the Johnson & Johnson. Their production isn't as reliable as the rest. Marisa, were you able to figure out the slides? Or I can't hear you, but that's okay. We'll just keep on going, I guess. And then There's two federal channels that we don't control that come in through the federal retail pharmacy, through the big guys, meaning Walmart's, CVS's, Walgreens, et cetera. They get directly. We guide who gets the vaccine, who is a target population, if you will, but we don't control the amounts that go to the retail pharmacies. It's the big guys I mentioned, but it's also the little pharmacies and the independents as well through their consortium, because it's really important.
Dr. Norman, I hate to interrupt you for just a second, but I'm just looking through this, and there's 22 pages, and you're covering an awful lot of data that we have here.
Okay.
It's very important information, but I apologize if you did not get the memo of why we're having this committee meeting. Vaccination progress is important, but if you could get to the phases and the micromanagement of counties, that is what we are really, really wanting to hear today. So if you could jump straight to that, that would be appreciated. Okay,
as a matter of fact, I can do that in 3 slides. But you go to slide number 11, please. Happy to do that, sir. We have a contract with the federal government that we went into them with in November. They approved our agreement, and which is to have a prioritization schedule. On 11, slide number 11, you see what are the prioritization schedule based upon. It's on individuals who are likely to have clinical outcomes that are bad and death. It's on proximity, meaning can people self-determine if they can stay away from each other, and distance, type of contact, like for example, exposure to droplets, shared surface, common items. That would be more like a preschool teacher and less like a college professor, for example. Contact duration, do they are in close approximation for a period of time, and are their ability to have protective measures. What you see on slide 11 is the basis of the prioritization schedule. And you see the footnote is in keeping with the Department of Homeland Security, what's an essential worker for infrastructure, and then what's the risk of spreading it within a population, which that led to the next slide, and that is slide number 12, although it's not labeled, it's this one following 11. And this is where the phases are. We're essentially through, we are done with 1, and 2 we're wrapping up in very short order. We'll be moving into 3 and 4, and then very soon, and then 5, of course, is the rest of the population. We have not, I'm not sure I agree with the word micromanage. What we allocate on the basis of a per capita, and when we query every week there we go. We query every week where a county is in terms of its phasing, because as I pointed out on slide 11, this isn't whether we like a county or don't like a county or something like that. It's how far are they, because the deeper you get into the prioritization schedule, the better off, the more well the people are. So phase 1 and 2 persons are high risk, not only high risk for themselves personally. 85% of the deaths, for example, have been in people 65 and older. Only less than 15% have been in people under the age of 65. So the phases are based on what's the likelihood that an individual will do poorly, but also importantly, whether they'll be super spreaders and whether the population is at risk. So what we do every week is query counties, where are you in the phasing, and how much vaccine do you need for the upcoming week or 2-week period of time? And we've had a number of counties that have put on a pause and said, no, we're finishing up phase 2. We'll get back to us when the rest of the state has come along. There was one instance where a county, and they even came back and admitted they had moved way ahead and didn't try even to do the phasing. We put them on notice that that wasn't in keeping with our prioritization schedule. We had a negotiation with them, and we went ahead and distributed to them as they went back and followed this prioritization schedule. They did not have a hiccup in terms of the amount of vaccine. We don't want to ever deprive a county of vaccine as they move through their phases. But a fundamental question, I think that what you're asking, Senator Hildebrand, is can one county just blow through 5 phases and leave other counties behind? And the answer to that is we try not to have that happen. Now, ultimately, will we move through these various prioritization schedule lockstep? As we move into 3 and 4, I'm sure that some counties will not have quite finished 2. Some will have finished phase 2 already. But there's been no punitive action taken. Nobody's been deprived of vaccine because of anything except for the one county that required a little bit of negotiation to get through it. That's really, I mean, you can use the rest of this as a resource document. I'd be happy, Senator Hildebrand, to answer any questions you have about the prioritization and moving through this.
Thank you, Dr. Norman, and we do appreciate the information because information is useful. Before I open up for questions, I do have a couple of comments. You said that you made a statement, and I appreciate you seem to be walking back we're not going to use this as an enforcement mechanism like was stated from your department earlier to make sure counties toe the line. Going back to one of your statements, you said in later phases you have they are more well.
Yes.
Someone with cancer is more well than a 25-year-old with no health conditions?
Recall there's 2 goals, and by the way, this is exactly the same prioritization schedule as the CDC has, and as recommended by the Advisory Committee on Immunization Practices, which guides the use of COVID-19 immunizations. There's 2 goals, and that is 1, to protect individuals that are at risk, and secondly, to prevent population spread. 25-year-olds are very, very able to spread the illness. We've seen that. They're not likely to require hospitalization and die, but they are very likely to spread it. We've seen that through college campuses, fraternities, and the like. So it's a slightly different goal. The cancer patients and people with severe illnesses will be picked up in the next phase. We know there's 18,800 cancer people in Kansas with actively being treated cancer. And they will be on the next prioritization group. They have been having to isolate and quarantine away longer than we'd like, but it's a judgment call. Do you want to protect a population or do you want to protect an individual?
Secretary Norman, I'm going to just make one comment, and then I don't want this to become a debate between you and myself. There's other committee members that probably have questions.
Sure.
But me personally, this is just me talking, personally, I think putting half the population, which is almost half, and by the time you combine phase 1, phase 2, that's the number. It's 1.2 which comes up to 40%, close to 50% of the state population. You are prioritizing before someone with cancer, those 18,800 individuals with cancer, or that have a heart attack, just because they're under the age of 64, just because they are not following your guidelines. You are not allowing counties that are within that community the flexibility when they deal and they see that individual every day and their heart is breaking, and because they got to tell that person, I'm sorry, but our state says you're not worthy of this vaccination until we give it to half the other population. To me, that is wrong. And I really, really wish you guys would go back and look at that. The second thing is, you try not to let that happen on enforcement mechanism. That should never even be thought of as an enforcement mechanism, especially when we are dead last to the bottom 5 of vaccine distribution. Secretary Norman, with that, I'm going to open up for questions. Committee, do we have questions?
Mr. Chairman, may I respond to your comment, because it's just not accurate. We're not the bottom 5. We're 38.
Secretary Norman? No.
Yes, sir.
You may not. Thank you. You may respond to another question, but mine was just a comment, not a question. Senator Petty.
Thank you, Mr. Chairman. So Senator Dr. Norman, I'll have you respond about our rankings when it comes to vaccine distribution. And also, could you be clear again about how long this prioritization phase has been out there from CDC? Is this new, or has this been the process that's been in place since we began getting vaccines?
Thank you, Senator. Happy to respond. Second one first, this is not a new schedule. This has been out since we submitted it to the CDC for federal approval in November. So, and really it's been very successful. They number it different at CDC. They're 1A, 1B, 1C, which equals 1, 2, and 3 for how our ranking or our prioritization schedule is. But it's not new. And we haven't deviated from it. In answer to your question number one, as of Friday, we are 38th, not dead last, not 5th from the dead last, but 38th in the nation. We had a data issue as it related to the uploading into WebIZ, which is our state registry, which is, by the way, determined by the legislature by statute to use WebIZ. So we follow along with that, of course. And there's an interface issue with HL7 and interface to made it difficult to upload. We're doing some workarounds and getting the data in there. And now we're up to 38. We feel that if we can get about half or 2/3 of the backlog of vaccine that's already been administered but not reflected, that we can be in the 20s. So solidly in the middle or upper part in the United States in terms of the success in getting vaccine into people's arms. We know that more vaccine has been administered to people than what was reflected in the COVID-19 tracker at the CDC, but as of Friday, we're 38th.
Thank you.
Senator Gossage.
Thank you, Mr. Chair. It's interesting that you should bring up cancer because there is a full community of people who have survived or are currently in lung cancer, one of which is my sister-in-law. And she has only half of one lung, and she's in this phase 3. Is petrified to leave her home, knowing that this would be a death sentence to her. But yet she's in phase 3, and she had a neighbor who is younger. I think she's in her 30s, but because of, she was able to file as being an essential worker somehow, was able to get it in front of my sister-in-law, who is a lung cancer survivor. So I agree with what our chair has said about putting these, especially lung cancer. Is there any provision to where the oncologist could state, this client needs to be able to be pushed up in the order? It just so happens, I just texted her to see if there was any news. She said she had petitioned 3 times to be moved up in the list. She said she just got her first vaccination on Friday, and it just so happened to be when her husband, who is in that second phase, because of his age, was able to go in to get his. Her oncologist happened to be volunteering, so he requested there at the site that she be able to come up and get her vaccination. So what can we do about, it seems to me that an oncologist should be able to say, these patients definitely need to get in. Could you address that?
Sure, happy to. It is the question really, and it's a good one, and it's an ethical decision. And by the way, we've had lots of input from oncologists in the medical community. And that is, do you treat an individual or do you treat a community? Collectivism versus individuality. And it tears at my heartstrings too. I'm a cancer survivor myself, and I surely understand what that's like. And all I can say is it's coming very soon, and it's a value judgment, and but it's also based in risk. And we are absolutely lockstep with the CDC on this, who has helped to determine it on the basis of evidence. It's not a value judgment, it's a basis of evidence, who's likely to spread it and who's likely to do well or who's likely to do poorly. So we're siding with the CDC on that, and it's going to come very soon.
Okay, thank you. We're going to go to another question, but Secretary Norman, you made a comment that we were 38th. I just looked at Becker's hospital review and we are 49th. Senator Baumgartner.
Thank you, Mr. Chair. Mr. Secretary, thank you for being here today. What steps have been taken to assure that we don't have another 600 or more or less of vaccines go to waste because they were improperly stored? In this situation, they were refrozen. How could something like that occur?
Absolutely agree with you. It was a big mistake made by the vaccinating site. They have taken ownership for it. They knew, and it says in very pronounced language on the packaging material, do not freeze, and they messed up. They came forth and said that. What do we have at every 800 vaccinating sites, do we have a policeman standing by? No, we can't not do that, but we do require them to follow the rules in terms of that. Yeah, that was a very unfortunate thing. 600 Johnson & Johnson doses lost, which is not good.
So I'm not talking about policemen. I'm talking about what medical professional is overseeing to make sure that we don't have an accident like that occur where, I mean, you talk about for those at-risk individuals, and we've heard it on the Senate floor. It's not just people of 50s and 60-year-olds, but we're talking about young adults, 20s and 30s, that have severe medical risks that are still waiting. So what steps have been put in place to assure that we don't lose valuable vaccines in the future?
We have a contract with each vaccinating site, and a pharmacist oversees it. Pharmacists are the best equipped to know how medications are stored and inventoried, and a pharmacist oversees every vaccinating site.
I am a little curious. One last question, Mr. Chair. You've identified that we're familiar with the phases and we've seen the chart, but this was approved by CDC back in November, and yet we know of many states, more than 19 of our states have modified, even as recent as just this last week, they have modified their phases to adapt to what they believe is new information and new needs particular to their state. So why have we stayed locked into ours that was determined back in November and haven't made modifications since then? Since obviously, I mean, when we're talking about Georgia and Tennessee and just a variety of states making modifications, why have we not adapted?
Well, we're following the best evidence and CDC guidance, which we continue to align with. And besides, again, 65-year-olds and older are 85% of the deaths and 85% of the hospitalizations. I think we've had a good success with what we have. It is a value judgment, no question about it. It tugs at our heartstrings to have people with illnesses that are not vaccinated yet. I agree with it, Senator Baumgartner.
Senator Stephan.
Thank you, Chairman. Thank you for testifying or being here today. You keep talking about the best evidence. Could you compile some of the best evidence and distribute it to the committee, please, in regards to making decisions as to how the distribution occurs? And secondly, you know, I understand that the vaccine has moved through various interpretations of that on the box or within the labeling within the box with the vaccine. It waives and says that it is not known to prevent the spread of the virus. And there's lots of data coming out that we see through the academic medicine stream that insinuates at first that the vaccine doesn't keep you from getting it. Well, but it does keep you from getting as bad or dying, but it doesn't really prevent the spread. So if that's the case, why would you prioritize young, healthy people over the older people at risk? If all we really are going to give to this vaccine is that it will decrease the severity of the illness or decrease the incidence of death, doesn't it make the at-risk group of people the real targets we should be shooting for? Or certainly the group of people you shouldn't be just rabidly denying access to. Thank you.
In answer to your first question, yes, happy to provide you the information coming out of the CDC and the Advisory Committee on Immunization Practices. Absolutely happy to do so. The second thing about acquiring the virus and spread, we're early on in this pandemic, really. I mean, we're a year into it, but this COVID-19, we're learning as we go. I think they have that as and Dr. Stefan, that the package inserts always have so many things to say, and some are more relevant than others. I think time will really tell. It does seem to be lowering the spread of the illness, but epidemiology will catch up with us. So we'll find out more as time goes on.
Committee, we have 2 quick questions, Senator O'Shea, then Senator Thompson, and we're going to move on.
Thank you, Mr. Chair. I have a constituent who is at the Wamego City Hospital. He's on the board there. And Riley County was planning to go into phase 3 because they've been really efficient and effective with their processes, and they were denied that option by the state. They're very disappointed, and it feels like because they've been efficient, they are being punished for that. And they said that constituents and people in the community are now driving to other communities to get their vaccination. So can you comment on that, please?
Oh, of course. They're not being punished. They just have fewer people that have taken it up in phase 2. Riley has gotten the same allocation on a per capita basis as the other counties. We never really know, is a population going to 40%, 50%, 80% of the people going to uptake the vaccine or not? And we find out that all populations are not created equal. The root of your question is a really good one, and that is, do we want some counties lagging behind with higher risk individuals as other counties move ahead? And it is a value judgment to say we want to treat the state as a whole. They are not being punished for being efficient. They just had an excess amount of vaccine. The solution here is more vaccine coming into the state, and unfortunately that's coming now, which you'll see through advancement of the phases here in the not too distant future.
Okay, let me be a little more clear with my question. Why were they denied the option to move into phase 3?
Because the state is trying to move ahead in general. It won't be lockstep, but we're trying to move the state through phase 2 before moving into phases 3 and 4.
One last question from Senator Thompson.
Thank you, Mr. Chair. Real quick, can you test positive after 2 doses of the vaccine?
Test positive for the antibody in your blood, sir?
For COVID-19, I guess.
The measure that we would typically use to see if a person is immune is a blood antibody test, and they would most certainly test positive after the 2 weeks after the second dose, yes.
Okay, thank you.
Dr. Norman, thank you for your testimony and taking the questions from the committee. We do have you up later on for Senate Bill 295. So again, thank you for your testimony. Committee, we will now turn to Julie Gibbs. She is with the local health, she's the local health officer with Riley County Health Department. She's just going to provide a little bit of virtual testimony on the exchange that they had with KDHE. I would ask that the committee you do have a copy of that exchange. Please just keep your questions to that, if you have any, to that exchange, please. Julie, welcome to the committee.
Thank you. Can you hear me?
Yes, we can.
Okay. Yeah, I just have a short statement as to what the exchange was between us and KDHE. So I will say that here in Riley County, we began structuring our phases last fall. We did follow the state guidance when they came out with their phases. We did adapt ours to look similar to the state's. However, we were under the assumption we could adapt to our county's needs, given our unique population here in our county. We've always followed KDHE guidance, but have tailored to fit our county's needs. Riley County is in a unique situation with the fort nearby, and being a university town, we have a very young population, a large workforce. Therefore, phase 2 did look a little different than the state's. We were asked about our phases, particularly how we were able to move on to phase 3 in an email from the state on a Friday afternoon, to which I explained we were ready to move on to phase 3 due to the fact that we were placing some critical workers behind us with medical conditions. when I was told that we had to follow the state's guidance, and until then, we would not receive any more shipments of vaccine. We did right away reconstruct our plan to match the states. We sent it in within 24 hours, and we heard back that we were approved and that our shipments would resume. We've always had a good relationship with KDHE, and of course, I did not want this to hurt our relationship. We just wanted to do what's right for our county, and getting vaccines into arms is our #1 goal. So those shipments were resumed, and now we're back to doing our 3 to 4 vaccination clinics a week.
Julie, thank you. Committee, do we have any questions for the conferee? Senator Petty.
Thank you, Mr. Chairman. And Julie, thank you for being here to testify. So did you, so you made a local decision to change, even though you had the guidance from the state, to change your population that you were serving in phase 2, and then we're making a decision to move on to phase 3 because of the changes you made without consulting with the state to begin with. But then you made a change back. And so did you actually not receive any distribution? Did you not?
No, we still received, we still received shipment that week. We did go ahead and cancel our Wednesday vaccine clinic because we didn't hear back from them until, they didn't have a chance to review it until Monday. So we heard back from them Monday late morning, but we weren't real sure when that shipment was going to come. So we went ahead and canceled that Wednesday vaccine clinic just because we weren't sure, but we did receive that shipment later that week.
Thank you.
Senator Stephan.
Thank you, Chairman. Thank you for being here today. Through November and December in particular, in regards to the vaccine rollout, were you told that the plan was a quote living document and very malleable and changeable at any point in time?
I'm not sure that I was told that directly, but through webinars, and I try to be on the webinars when I can, but with my busy schedule, sometimes I have to rely on the notes from those webinars. But by reviewing those notes, that was my understanding, was that it might change, as things always have throughout this pandemic. You know, when we get to know more information and see more data, we do make some changes. So we've made many changes here in our own county.
Julie, I'm just going to leave you with a question, and we're going to close this part and go to our hearing on the bill. But in your email, you said we are doing 4 clinics a week. It is not just the health department. It is a team effort with EM, EMS, fire department, police department, 30+ volunteers, our ID department, etc. So far, we have had such a great response and a lot of community support. This is the first time in a long time that our community has had a happy vibe. We are loving it. When I read that, and how is that vibe today?
You know, we were a little concerned when we heard that we were going to not get shipments, possibly not get shipments for a week. So I think there was just a little bump in the road there, but I think we're back to hopefully good vibes this week. I know last week we had 4 clinics, and everyone was very excited that we were able to offer the vaccine again. So we're back on the road again, you know, offering vaccines. So I hope that our community continues those good vibes.
Julie, thank you very much. Senator Erickson.
Thank you, Mr. Chair. Thank you, Julie. I just have a quick question. You mentioned some unique demographics, some unique situation to Riley County. Is it fair to say that Riley County isn't like every other county in the state?
Definitely. Yeah, I think, you know, given Fort Riley and the university, both of those things kind of set us apart from the rest of the state. We do have a younger population here.
Very good. Now, a follow-up, Mr. Chair, if I may. So we hear a lot about local control and the people closest to those that they serve and being able to make the best decision. Is it comforting to you to know that Secretary Norman kept referring to, well, gosh, we're just following the CDC guidelines? Do you think Kansans and your community would be better served by allowing local control over vaccinations? Thank you, Mr. Chair.
Well, like I said, we've always had a good relationship with KDHE and we do follow their guidance. We've followed it as far as our isolation and quarantine guidance to this point. And yes, we do have to vary sometimes with the guidance just based on our population needs. So I think it is good to know that we are able to do that at times to fit our population to do what's right for Riley County.
Thank you, Julie, and I understand that when you've been threatened with the withholding of vaccination, it's hard to come out and say that. So I appreciate your honesty and you being here.
Julie, thank you again for your testimony. One last quick question from Senator Stephan, and then we are going to move on.
Thank you, Chairman. It's more just a comment. I do think everybody here should know that in the Kansas statutes, Chapter 65, the Secretary of Health and Environment has the right to fire the county health director. I think that's an important thing to understand, that they have that kind of reach down to the county level. Thank you.
Thank you. Julie, Dr. Norman, again, thank you for taking the time out to come in and discuss this very important issue with us. Committee, we are now turning our attention and opening the hearing on Senate Bill 295, giving counties the authority to adopt, prioritize COVID-19 vaccination plans separate from state guidelines. We will have an overview from our revisor's office. Jenna?
Thank you, Mr. Chair. Good morning. This is Jenna Moore in the Revisor's Office, and Senate Bill 295 would give counties the authority to adopt prioritization schedules for COVID-19 vaccination plans that are different from state guidelines. The subsection A just defines relevant terms. I took the terms for COVID-19 from the SB 14 that passed last year. And then subsection B just says, notwithstanding any other provision of law that a county, which would be the Board of County Commissioners, et cetera, could adopt a resolution that would set out that county's plan for distribution or administration of vaccines. And it gives a few guidelines of what would have to be in that, prioritizing the same principles from the CDC, which would be widespread access to the vaccines, minimizing vaccine acceptance or maximizing vaccine acceptance and protecting the public health and minimizing waste and inefficiency. And that subsection B2 would allow a county's vaccination plan to differ from that recommended by the KDHE. And the subsection, so that'd be A3, specifies that a county's plan cannot cause or permit a vaccine to be distributed or administered in a manner that violates federal law or recommendations. If a county were to do that, it could put at risk the vaccine that's being sent to the state, which is why that provision was included. And then that subsection C2 states that the department cannot reduce or delay vaccine allotments to counties based upon a county's decision related to vaccine distribution. And D expires this statute or this bill on December of 2022. And with that, I'll be happy to answer any questions from you.
Committee, do we have any questions for Jenna on the bill? Seeing none. Jenna, thank you very much. We will now move to proponent testimony. First up, we have Jim Howe. He's a Sedgwick County Commissioner, and he is attending virtually. Jim, Commissioner, welcome to the committee.
Good morning, Mr. Chairman. Can you hear me okay?
We can. Thank you.
Very good. Thank you for the chance to speak this morning, members of the committee. I'm certainly not an expert on this particular bill, but I am very passionate about the topic. I want to say thank you for introducing this into the process and having a chance to speak. First of all, I'm speaking as an individual commissioner. I do represent 1/30 of the state's population. Last week, the Sedgwick County Commission did come together and we did vote unanimously to send a letter to KDHE and Governor Laura Kelly asking for some permission or some latitude to move those with the most fragile health out of phase 3 and into phase 2. We're not asking for everyone with underlying health conditions, but those that are the most fragile. And I think we know who they are. In fact, I would say we ought to trust our physicians especially to make that determination on those that have the most fragile health. There are some folks I know that are dealing with stage 4 cancer, going through chemotherapy and radiation, that are just under age 65, that they've been told that if they get coronavirus, they have a very low chance of survivability. And these are the types of folks that I think that need to be given some type of priority. I would disagree with Secretary Norman on one point. Phase 1C, as outlined by CDC, does list in this order, and it's, by the way, if you have a copy of my testimony, you'll see this on near the bottom of page 1. But and I also provided the link to this. This is actually on the website right this minute. But it lists people aged 65 through 74 as equal with people aged 16 through 64 with underlying medical conditions which increase the risk of serious life-threatening complications from COVID-19. The reality is, I think the state proposed something to the federal government, and it was approved, and I think the state made a mistake, and the state needs to pivot. Many other states have taken this population and given them some consideration, but the state of Kansas is digging in and not giving some consideration to this very fragile population. I have talked with people just in the last couple of days that are in their 20s and 30s that are very, very healthy folks, but because they're in work careers that give them access to the vaccine, they're stepping forward and getting the vaccine, which I'm happy about. But the reality is, I think everybody with common sense would understand that someone with stage 4 cancer has a higher risk of COVID-19 than someone in their 20s and 30s that are otherwise very healthy. The reality is, I'm not asking for everybody with comorbidities to be moved from phase 3 to phase 2. I think that those with very, very fragile health ought to be given special consideration. I understand the state doesn't want to move one county into phase 3 because other counties are still in phase 2. I'm not going to question that policy. I understand the reason why they might say that. But I do think that they've made a mistake by keeping these people that are extremely fragile health, leaving them in a much lower priority than people in phase 2. I think that's been a mistake. And I think that what I see right now is we're digging in politically rather than using common sense. And I'm sorry to say that the state's been a good partner of ours. I know they're doing the very best they can, and we're doing the very best that we can. But as a commissioner of this district, I can tell you I get more email than any other topic right now on this very topic. This has been a huge problem for people in my district. And I just want to say, I think we made a mistake. It's time to do something different. I would encourage, and by the way, I understand this bill, by the time it becomes law, would probably already be in phase 3. That's beside the point. This is a principal issue, and I appreciate the discussion this morning. I would encourage the state of Kansas and this committee to pressure the state of Kansas to make a pivot right now today to move these very fragile folks back into phase 2 where they belong. It was a mistake from the very beginning, and I would ask the state to admit that, and let's move forward and let's make a correction to what we did wrong from the very beginning. With that, I would stand for questions at the appropriate time. Thank you, Mr. Chairman.
Commissioner Howell, we appreciate your testimony. I know we do have a couple of questions. I know this committee and the Senate as a whole sent a strong message a few weeks back when we did a resolution requesting that the phases be relooked at. Unfortunately, it fell on deaf ears. At this time, Senator Gossage has a question.
Jim, thank you so much for being here. I don't know if you heard me mention earlier about the lung cancer support group and their concerns that they were not moved into an earlier phase. We heard the Secretary, Norman, say that it's a moral decision. We're trying to stop the spread. However, why are we trying to stop the spread when this illness is 99.8% survivable? Wouldn't we trying to stop the spread to those that are vulnerable? The reason we're trying to stop the spread so is that it won't get to those who are vulnerable, but yet we're moving them back. Is that how you see it?
Oh, by the way, I did hear your story, and I have many stories similar to yours, and I appreciate that perspective. I think you're exactly right. Many of these folks in this category are finding creative ways, like your relative there, to go ahead and get the vaccine. They're finding creative ways to get a phase 2 vaccination. I think the mistake that I think that the administrators are making that have made this choice is they don't realize that these folks that are extremely vulnerable are still in the population. They still have to go to the grocery store. Mm-hmm. They still have to be among the population. So when they made in my opinion, a political decision to, again, I know they're well-intentioned. I'm not trying to say they didn't make a good, they're doing the very best they can. But the reality is I just disagree with them. I think we would know that these people are still among us. And the idea of keeping those that are the most vulnerable from ventilators and death has to be our highest priority. I think everyone in this committee has made a very good point here that if you're focused on stopping the spread, that's a very noble goal. But the reality is these folks that are very fragile are going to come into contact with this at some point. The best thing we can do for them is to give them some immunity as soon as possible. And again, I think it's it's two goals here that are competing with each other. But at the end of the day, I think that these folks that are extremely high risk and very fragile, very fragile health, they deserve the right to not have a death panel essentially make a political decision that puts them in the back of the line.
So in essence, you're not saying that you're moving that you were moving into phase 3. You just felt there were some people that were currently in 3 that should have been in 2, and you wanted to get them treated, those vulnerable people. Thank you, Mr. Chair.
Absolutely. Thank you for the question.
Okay, we have 2 questions that I know of. We're going to go to Senator Petty, then Senator Baumgartner.
Thank you, Commissioner Howell, for being here. I do want to ask you the question because you are, you're one of the largest counties or you're the second largest county in the state of Kansas. So at this time, have you been able to provide vaccines for all of your essential workers?
So thank you for the question, Senator. We are in the middle of phase 2 right now, and they've finally opened the gate to everyone in phase 2 according with KDHE guidelines. And so all those occupations that are considered essential workers that are in phase 1 and phase 2 have now access to the vaccine.
And so all of your teachers, all of your grocery store workers, your faculties at your universities, they've all are now in line to get the vaccine. And have they all had the vaccine yet?
No, ma'am, they have not all had the vaccine, but the gate is open and they're able to get appointments as soon as they step out and make the appointment, they can get the vaccine assuming we have vaccine available. So the gates are wide open for those groups. Teachers have their own allotment. We're treating them with special consideration. And of course, everybody in phase 1, they've all essentially have completed their opportunities. There may be some people in phase 1 that still may want to access vaccines while we're in phase 2, but for the most part, phase 2 is a pretty long line. And so there's a number of people that are qualified to get the vaccine that haven't got it yet, but they're in line to get that.
Just as a follow-up, have all of your 65 and older gotten their vaccine? Because that is a population that I'm sure you've gotten lots of calls from, that you've gotten lots of emails about. Where can I go? How can I get it? So have they all gotten their vaccine?
No, ma'am, they have not. That gate opened up last week, and so about a week ago, that gate opened up, and thankfully, we've had a lot of folks in that category have engaged that opportunity. There's way more people in that category than we have vaccine available, so it's going to be a little while till we get through phase 2.
Senator Baumgartner.
Thank you very much, Mr. Chair. Thank you so much, Mr. Howell, for being with us today. I'm curious because you indicate that the action was taken by the County Commission on March 3rd, and in your letter from the 12th, you indicate that you've not heard back from the governor's office or from Secretary Norman. Have you still not received a response?
Thank you for the question. That is in fact true. I understand there's some folks in our organization that have had verbal discussions with people at KDHE and in the administration, and they've had confirmation verbally, but we've not received any type of formal response from our letter that we sent formally to KDHE with this request.
And as a follow-up, based on the action that was taken, the unanimous action that was taken, are we to assume that the way in which you thought this might work out is if an individual with that underlying medical condition appeared with a prescription from their physician, that would be the means? If they went to Walmart or CVS or went to one of the other distribution locations, that would be essentially their ticket or their prescription to get that during phase 2?
Well, that is my idea. I think the physicians know their patients best, and I would hate to do any other. I think that to me it would be a very common sense way for us to go forward. I think it makes a lot of sense. That is my idea. I'm open to other ideas. My main goal here is to get these folks a shot, and how that's done. The logistics is maybe can be debated, but I think that does make a lot of sense. Allow these folks to access a shot through a physician's prescription, going through the county health department or through a clinic or through a pharmacy. As long as they have that prescription, that should give them a qualification.
Thank you, Mr. Chair. And that really does coincide with what the Secretary told us back, it's been more than a month, when we had the joint hearing with the secretary where a scenario was presented about an individual that's a caretaker for an adult child with a disability, and the concern was why can only one of them get the vaccination, not both? And the secretary indicated to us, the House and the Senate Joint Committee, that he would hope that there would be some leeway given by that county that was administering. So thank you, Mr. Chair.
We have one last question. This is from Senator Holscher. She is attending online. Senator Holscher?
Thank you, Mr. Chair. My question is just this: if a county does change prioritization as far as the individuals that you pointed out, sir, what then happens as far as the over 65 population who they are high risk? What about the pushback from them?
Well, that's a great question. Again, I think this is a little bit political. If I ask people in that age range, would you want to share this priority with people with stage 4 cancer? I get nothing but affirmative yeses. I think that I don't care who you're talking to. Ask anybody that question, whether those that are the most fragile among us should have access to the shot. You're going to get a resounding unanimous yes from everyone. So I understand the point you're making, that it seems like we're pushing people with age 65 down the priority list. But the reality is, I think even CDC had it right. They actually equated, if you will, people with underlying medical conditions which increase the risk of serious life-threatening complications. Actually, they put them at the same priority as people ages 16 or ages 65 to 74, based on age. And by the way, one thing I wanted to mention is even Dr. Norman used this phrase. I think he said that they wanted to give priority for people who had a negative clinical outcomes and death. That was a phrase that Dr. Norman used, but yeah, when it comes down to people who are the most fragile health among us, for whatever reason, they've not been given the same priority as people who simply are older. And I just think it's a mistake that the state has made. And CDC, I think, actually gives us ideas that we should move forward with this population. For some reason, we've not chosen to do that.
Thank you, sir.
Thank you, Commissioner, for your testimony. Committee, we do not have any other verbal testimony. We do have written only. We'll draw your attention to that. Do we have anybody else wishing to testify as a proponent? Okay, not seeing any. We do not have any neutral testimony. Is there anybody wishing to testify as a neutral? Okay, the only opponent testimony that we have is written only, and it is by Dr. Norman. Is there anybody else wanting to testify as an opponent? Not seeing any. This will close our hearing on Senate Bill 295. Committee, I'll tell you, I kicked this around a couple of times, and I think this is where I would like to go, and I'm going to ask for your permission. We've heard several times that we cannot get this bill passed before we move to phase 3. I think it's very important that we do get it passed. So if there are no objections, I would like to work this bill and get it kicked out today. Okay. Senator Petty?
Well, we actually have a senator who's not here and would not be able to vote, so I will object.
Objection is noted. Anybody else? Senator Stephan?
Thank you, Chairman. I would like to discuss with you another situation related to this, and would recommend that we wait till tomorrow to work this bill.
Okay, seeing objections, we will hold off.